Determinants of Health and Education Work Group to our May meeting. We have a series of presentations tonight, and we're going to kind of take care of some housekeeping items first. Jason Bork from DSU is going to navigate our slides for us. So Jason, you can keep rolling through the slides as we kind of just touch base again on our meeting norms. If you're not speaking, if you could stay on mute. Use the chat function to ask questions. Co-chair Ray Jones Avery is going to be monitoring the chat during the various presentations. We will have a public comment at the conclusion of the meeting. So if you're from a member of the public and you wish to speak, also please indicate that in the chat, and Jason will be sure to bring you forward at that time. As always, the meeting is being recorded, so we just ask that you identify yourself before you speak. Next slide, Jason. We're going to roll call. This is for right now for those who are members of the Social Determinants Work Group, just so we can capture these names all in one spot. If you're a member of the work group, if you could just put your name in the chat to indicate your presence, that would be great. And that way we will do roll call that way. And Jason, we still short? I believe we are.
Okay. One short so far. We've got 9.
Okay. All right. So we're going to move over the, you can go to the next agenda item. We're going to skip over the minutes from the last meeting right now until we get to a quorum. We'll close out with that. Our schedule this evening is here in front of you on the screen. We're going to have 2 presentations. The legislative update was tentatively scheduled, has now been, we're not going to have that conversation. Representative Williams is in caucus, I believe, this afternoon, started just now, and probably will not be making it to this conversation. So we're just going to hold off on that until the next time we meet. The general gist of the general flow of the presentations is the presenters will have 25 minutes to share a presentation, and then there will be 10 minutes of Q&A for the Social Determinant Work Group members to ask question and answers. Then we'll stop after the first one. We'll do another 25-minute presentation, and then have another 10 minutes Q&A from the Social Determinant Work Group members. And then we'll move on with the agenda to the scheduling and setting up the next meeting, as well as public comment. That said, I am going to turn the program over to Social Determinant Work Group member Dawn Alexander to kind of tee up this presentation. This is definitely her wheelhouse, and I think that she would do this more justice than I in queuing up the presenter. So Dawn, I'm going to turn it over to you.
Great, thank you, Dr. Mentor. Hi everyone, I'm Dawn Alexander. I'm the preschool coordinator in Colonial School District, and I have the pleasure of introducing 3 people who will be presenting this evening. Yvette Santiago Fuentes, who is the Early Childhood Associate Secretary with the Department of Education. Kim Krasnowski, the Director of the Office of Early Learning, and Betty Gail Tim, the Director of the Office of Child Care Licensing. And we asked them to come this evening to talk about developmental screening, but also there's another piece of legislation, the move of IDEA Part C, and we're talking about them together because they go hand in hand, or a lot of the work would align. So there's been a lot of discussion, particularly among our Reading Consortium, our Social Determinants of Health work group, regarding the need to increase access to developmental screening. We know that national data teaches us that many children who face barriers of race and poverty do not have the same access to developmental screening, and therefore do not have the same access to early intervention and special education services prior to entering kindergarten. So they'll be speaking about that piece of legislation, which Representative Williams, I spoke with her this weekend. It is very soon to be filed. And then the other piece of legislation that aligns with that is the move of Part C, IDEA Part C from DHSS to DOE. Both, if passed, would move on July 1st, 2023. And that second piece of legislation would really align the early childhood work. And we know with alignment, we would again reduce barriers for children and families. So without further ado, I want to ask all of our presenters from DOE to introduce themselves and go ahead and Yvette, you should be able to share your screen. Thank you so much.
Yeah. Hi, everyone. Good afternoon. I'm Yvette Fuentes, as Dawn shared. So thank you for the opportunity today. And Kim, do you want to introduce yourself really quick?
Sure thing. Thank you. Hi, everyone. Kim Krasnowski. I'm the Director of the Office of Early Learning at the Department of Ed.
Unfortunately, Betty Gail Tim couldn't be with us this evening. So we will, if we can't answer a question that's for Betty Gail, we will share that with her. She's got a family situation, so we want to honor that. But we're thrilled to be here tonight. We will do our very best to answer as many questions as we can. I want to first off thank Dawn for the invitation and also for her support and her partnership as we've been going through this process. This is new for me. This is kind of my first big legislation piece since I've arrived in Delaware in early November. And it's been, I think, a very good back and forth process, and we've ended up in some good places. So we are really, really excited to be here. As Dawn mentioned, I'm going to start to share my screen here. There is a lot that is going on as it relates. Oh no, can you still hear me?
We can still hear you.
Yeah.
We can hear you. Sometimes it's buffering, so it might take a minute.
It
It's got
is.
a lot of graphics. There you go.
There it is. Okay. As Dawn mentioned, we've been going through this process, and one of the main points that we really had a lot of back and forth with was the actual implementation of this. And one of the things that I want to share, just sort of kicking off this conversation, is that there is a lot of work to be done as it relates to both developmental screening for all, but also the Part C transition. There are a lot of lessons learned from the Department of Education through the transfer of the Office of Child Care Licensing. And while I would say that most of us would say that that went well, there are still some glitches and some little things that we're still working on figuring out and working out. And so we want to make sure that as we both go through the Part C transition, but also take into account developmental screenings, that we're really thinking through all of the systems and the process pieces that have to be taken into account, because what we know is important about this is that we want to make sure that there are no gaps in services for kids and families. And so as Dawn already mentioned, July 2023 is the implementation day. And I put with caveats for Part C transition, just because I want to mention something very specific about that when we get to that. So let me go ahead and just get started here. So we'll start with developmental screenings. We're much further along as it relates to developmental screenings. We have some amazing team and colleagues at DOE led by Cindy Brown and Mitch, who many of you know. And so they've already done a lot of this work. And so we know that this is going to be a much easier place as we go along. So we're going to break up the implementation of developmental screenings into 2 phases, beginning this year, actually. As many of you probably already know, we use the ASQ in Delaware. There is already an online system that many providers are familiar with, particularly those in the school districts. But one of the things that we know is that it's going to require a lot of training for our childcare providers, particularly those who have probably no familiarity with ASQ or just have not really been doing any sort of screening with their kids. So we know that across Delaware, it's a mix of the education level or the comfort level with screenings with providers. And one thing that we really want to make sure of is that we are taking into account our big, center-based care where we know they get a lot of supports, to our small family childcare homes where we know it's probably one provider and, she's got a lot of stuff going on. So we want to make sure that we are going to be able to support them. The other thing I want to say about this as well is that we also need to have a conversation with Brooks Publishing to really kind of understand the cost of all of this as we go forward, especially when we're talking about all children. And then obviously, when we're thinking about the data system, we are going to have to make sure that providers are not only comfortable with the tool, that they also get comfortable with the data system and that we are able to make sure that they are up and running as we get this process going. In addition to that, obviously, we want to talk to all of our LEAs because we know that some of this is going to fall on them, particularly since the data systems really do live within that system. And so we want to make sure that we're making the proper connections between childcare providers and our LEAs. We know that some of that does happen locally, but we're not really sure how much of that. So we really want to start to think about how do we bring the two groups together so that there is more familiarity, but at the same time, we're really hoping, I think, to build that alignment from early childhood into the school districts, into the LEAs, so that there really is more communication, not just at the provider level, but even as providers are thinking about families and how do they transition families into our K-12 system. One of the things that we know about this is that families will have to give their permission so they can decline. And so with that, we want to make sure, again, that providers have the training and the language and the words to be able to talk to families about why this is important. And then when they need supports, that they can reach out to their local schools to be like, I need a little bit of help with this, or, maybe you can give me some talking points as I'm talking to my families, or even my other staff throughout the center, teachers who would be supporting some of this and doing some of this work. We also know, though, that we're going to have a really tight connection with our special education directors. We want to make sure that they're in the loop and they're at the beginning and at the table of these conversations as we're really making plans and putting in the details. And so one of the things that we like to say is, like, right now we're sort of got the house going on, but we really want to make sure that as we're filling in those rooms or we're coloring, in the lines, that all of the people who need to be at the table are with us, so that we can make sure that we are not leaving anything to question, and most especially so that we're understanding what may be the unintended consequences of a decision that we make. And so again, want to be sure that everybody's at the table. So really looking to you all, I think, to help us think about who else needs to be there and who needs to be there early and often.
Yvette, I'm sorry, could I add something real quick to this slide, just to give some, maybe some additional context, and please Cindy or Jamie Walco, please jump in too. It says increased capacity needed at LEA level, but I also want to highlight the fact that over the past year, almost 2 years, the Department of Ed has been working really immensely with our LEAs and our childcare partners in the community to start to establish this relationship. So it was, over the past year that, MOUs were signed, a lot of education, a lot of talking back and forth about how this could work, because we did a shift. The pendulum shifted about a year and a half ago, where LEAs were now much more involved in reviewing ASQs and working with childcare partners, because we knew, although, legislation had not been drafted, we always knew that the strengthening of between LEAs and community-based childcare had to keep growing, right? So we had some foresight in this to know that, regardless of a bill or legislation, this was the best thing for children and families if we could help that relationship grow. And Cindy could add, it's been, we've had some growing pains, but we are in a much better spot today than we were last year, because we've had to communicate, work with our LEA partners, and they had to then work differently with their childcare partners. partners, so that childcare didn't believe or didn't think that things were taking away from them. But if a screening came back and there was an identified need, the school district was going to have to service the children and families anyway. So what we tried to do under the leadership of Cindy and her team, they're the ones that did this, was to really start to have those conversations, to put into a place a procedure where this wasn't starting from scratch. So when we say increased capacity, the foundational level, and I think for some cases even above that has happened, but to go from just looking at STAR programs 4 and 5 to now looking at all licensed facilities, there will be additional staffing or capacity needs on both sides, but we are not starting from scratch. I just wanted to make sure people knew that that had definitely been a work in progress. Cindy, would you add anything to that? Oh, you're on mute, Cindy.
Yes, I am. Thank you. Just some of the nuts and bolts. We rolled out this new system in the fall of 2020 before COVID started. So really, we just had a few months under our belt where we had our school districts making a commitment to this initiative. They have a child find duty under the IDEA, the Individuals with Disabilities Education Act. Our programs, our childcare programs in our quality rating improvement system had a responsibility to screen children in their programs. And so we had a lot of duplication of effort going on. And so with Jamie's partnership and encouragement and with Dawn's partnership on this, we really were able to convince the districts that let's really forge this partnership and change the way we do business and move forward. So we have about 350 providers in the system currently. They're set up as classrooms in each school district, and the school district receives the screening. They review it because they have the expertise. They have certified early childhood special ed teachers who can look at that information, and then if necessary, follow up with the families to go on to an evaluation for special ed. If not, we make a note so that the childcare provider, they can also access the system from their side. They can see the status, they can see what happens, they can produce the evidence for their verification for the quality rating system. And that's what we're talking about in this new bill, being able to verify that all of your children have been screened. So we have set the system up for expansion. It's just going to take a bit more collaboration, coordination, and a bit more lifting. And we need to make sure that our districts have the capacity to do this, because it will have consequences of increased referrals, increased evaluations, ultimately increased identified children. So this will expand the program significantly over time.
Yeah.
May I add something?
Sure.
I'm having some technical problems, excuse me, that's why I'm not on the screen. Just as Cindy had noted, we only had very few months of when we were actually through the entire process where the child cares needed to, where the school districts or birth to 3 needed to actually review the screenings and then place those screenings into the classroom so the child care could then see it. There was a lot of difficulty. What we found were many of the programs did it at the very last minute. The school districts were not then able to review the screenings in the time that was necessary. So we had to get that information over. It caused a ripple effect, and we never really got to resolve any of that because COVID hit and STARS stopped verifying. So although we've had this process in place, I just want you to know there's a lot of bumps that we're still working out, and we do need time to resolve these issues.
Great. Yeah, thank you. And I think that that's the biggest piece is that, thank you both, is often we do have the pieces in place, but we do want to understand what it's going to take. I also think that often, as we've been having these conversations, it's sort of just been with the early childhood team, we are taking the lead on this, but there are a lot of our other colleagues within DOE that we're going to have to bring into this process as we're going forward. And please, Jamie and Cindy, please feel free to jump in at any time. So I think this, I think Jamie and Cindy and Kim all spoke to this, but we're also going to have to, while we're doing our own internal planning and implementation and making sure that we've got everybody at the table who needs to be at the table, we also at the same time have to continue the conversations with our colleagues over at Public Health, because we do need to understand how the funding sources have been used, if they're making any plans, as we're getting ready to transition everything over. So those conversations are also going to have to start to continue. And at some point, we'll just have to figure out how we really bring all of those pieces together. In addition to that, just the last bullet I'll highlight here is the staffing pattern to be in place to implement on the effective date of the legislation. So it feels like 2023 is really far out, but it really isn't as you start to think about all of the work that needs to happen. And one of the things that we've been talking about on our team is that everybody is sort of really at their bandwidth. And so really trying to think about how we can manage this process and also keep the day-to-day work going on, because what we don't want to happen is that we start going down this path and suddenly we've got another emergency or crisis or priority that comes up. And we want to make sure that we are keeping the momentum on this, because otherwise it will be really easy for us to miss that deadline. And that definitely is not something that we want to happen, but we do want to make sure that as we've got the next 2 years going and going through these two phases, that we really are making sure we're having the right conversations. I think, we're in a good place as far as developmental screenings go. I will also say that we also want to make sure that as we go through this, and we are also thinking about the STARS redesign, that we're also taking into account how all of that may fit into this. I know we've had some conversations around children with special needs and supporting their families, and how does that fit into our new STARS redesign, as well as increased educational requirements and competencies. So all of these pieces are really coming together almost in the perfect storm. And so we just want to make sure that we're not going to lose track of any of them as we're moving forward on developmental screenings, Part C, STARS, and all of the other pieces that are going on. So I don't know, Cindy or Jamie, if you want to add anything.
I think in the chat box, Ray put some comments, and that is something I think everyone needs to be mindful of, that, as I mentioned earlier, if we're going to dramatically increase the number of children across the state that are receiving a developmental screening, it stands to reason that more children will be referred for special education eligibility evaluations, and that out of that, more children will be identified for services. And so, that is going to take increased capacity at the districts. And we know because of COVID, I think we're hearing a lot about fatigue, and we know that just a lot of districts are having trouble even recruiting staff for this summer. They really want the summer off. They want a break. And so I think we really need to think about the workforce and the capacity to meet these needs down the road.
Yeah, and I would say that that's one of the things that we brought up very early on, was just sort of do we have the system in order to be able to support the increase in referrals? And so I think that is something that we've got to look into, and we've got to think about that as we're thinking about the workforce at multiple levels. So thanks, Cindy. Go ahead.
I know that Representative Williams is not here, but I am going to speak for her because she's not able to speak for herself right now. And one of the things that we discussed is one of the benefits, certainly a benefit of the waiting for the legislation, waiting for implementation to go through for 2 years rather than 1 year, is that it would give DOE staff the opportunity to investigate what you believe the cost would be for full implementation. And then that budget, that could be part of your budget ask for fiscal year 2023. So in the Reading Consortium recommendation for the implementation of developmental screening, we did put funding in that recommendation, but we know that was a guess. So for you to be able to do the work, to have the time to determine what that funding you would need, this gives you the time to do that because it's 2 years until implementation.
Secretary Bunting, you wanted to add something to the
Yes, only that as we take on more things at the department, I really appreciate everything that our staff is doing and they're willing to do, and they do it well. But we also need to think about the human cost. And so if there can be consideration of not just resources for the screening materials and the data system and so forth, but human resources. We right now have a cap on how many people we can have at the department, and that hasn't changed in 4 years. So we're stretched. And as we take on more things, if we can have some support for considering extra personnel, that would be very helpful.
Exactly. Thank you, Secretary. There was another comment, I think.
Yes, it's Jamie again. Sorry. I'm glad that you brought up the comment about opting out of the screening, because that is one of the concerns that I have. When parents consent to screening, they are also consenting to the fact that they're willing to share that information with DOE, with DPH, with a variety of state agencies. That is one thing we are going to have to make sure. If a child care is going to complete a screening on a child, the family needs to know that a lot of people in the state are going to be looking at that information. So that the last thing we want to happen is for a family to be blindsided with a call from either the school district or Birth to Three saying, I have your screening and we'd like to talk to you about an evaluation for special ed, and the family not knowing A, that the child was screened, or B, that information was being shared. I'm very concerned about that. We've been trying to really set this up so that we're working with families and that we are a team and building those relationships. And I really believe that there's many families that already distrust the system. That's one of the reasons I hear that people are not interested in completing the screening, is because they don't want their information online. So we have to be really careful about that.
And I think that's really where we're going to have to get with providers and really start to inform and educate them of how we sort of can talk to families about why we're doing this and the importance of this. But it's a really great point, Jamie, and it's actually a point that came up earlier today in another conversation, as we are really trying to think about how to bring our childcare community into the fold and take advantage of the systems that do exist. But there's a lot of education that has to happen there. So
right. And I'm working on a grant with the University of Delaware, and we're in the process of developing a training for families about the importance of developmental screening, because we do recognize that the child cares often have a difficult time introducing this and really getting the point across as far as how important this information is and why we're doing it. So this is going to be made into a webinar, which will be made available to all of the child care so that they can share it with their families as a way to introduce the developmental screening and really hit home as far as the importance.
awesome. Thank you.
So it's 5 o'clock and we're coming up on another, 10 minutes. So this has been a Q&A ongoing. So I know we have a lot of topics, and we have another presenter queued up. So I just wanted to put that on the radar. So please continue.
Okay, so let me just take you through this very quickly. So phase 2 will take us into the next year of July through June 30th. Obviously continuing to really think about the screens, but what I want to bring up here is that one thing that will happen is we will have to update the childcare regulations. And so that will take a little bit of time, because obviously we do have to make sure that it goes out for public comment, that we take the comments seriously, and then that we update them as necessary. So we will have to update the Delaware regulations. And so unfortunately, as I mentioned, Betty Gale can't be with us today. But one of the things that Betty Gale did want me to share with the group is that this is the box here that you see with the centers and their license capacity. This is what we currently have in our system as it relates to all licensed childcare in Delaware. So you're looking at a total about 444 kiddos who will be coming into the developmental screening system. And so I know that Betty Gale would want me to share, just as Secretary Bunting mentioned earlier, really sort of the staffing side of it is really, it's going to take more people, more humans, more bodies to really do this process and to do it well, both on the front end as we're training, but also as we're thinking about the increased referrals that most likely will come from this. So currently, you know, in the legislation, it does, in the legislation, it does say that OCCL will examine each child's file. And so we really see this as being a 3-step process for OCCL. We are also thinking about other ways to do this. We know that we'll be able to tap into some technology that gets used for this. And so we're really trying to think about how both of those pieces fit into that. How do we use the technology? How do we make it easier for our licensing specialists to ensure that all kids really are getting screened and referred? But also, how are we making sure that we're working efficiently and effectively and not adding to that? So just wanted to share this very quickly, but this is sort of the current state of where we are in Delaware as it relates to licensed childcare. So let me just move on because I do just want to go into Part C very quickly. So the Part C transition to DOE would also be scheduled to be implemented in 2023. And we know that with Part C, it's going to be a much bigger transition because we're not just talking about screenings and training. We're actually talking about moving a whole infrastructure of not just technology, but also people and money and equipment. And so this one, we're not quite at where we are with developmental screenings because we're really looking closely at the federal regulations and the federal guidelines for how you can transfer Part C from one department to another. We know that our colleagues over at DHSS are doing a lot of work as it relates to the Part C program based on a monitoring review from the federal government, from the Office of Special Education at USDOE. And so they're addressing any challenges that came up in their monitoring report. We know there's also a lot of money coming down the pipeline from the American Rescue Plan Act. And so we are in conversations with our colleagues to figure out how they're going to be using that money. And can we think about how that money can support or start to support building the transition over of Part C. At DOE, we've got to think about infrastructure, staffing, and regulations. One thing that I will say is that as we were talking with Senator Sturgeon, she's been very open to all of this, and she definitely understands the human need on this side. And so we've been working very closely with her and with Dawn and with Senator Sturgeon's team to really think about how we can get additional employees at DOE in order to really manage this process, because we know that this is going to be a much bigger lift. So I'm just going to take you through sort of the requirements very quickly here because it is a lot. So one thing that we do know about moving Part C is that the federal law says that only the governor of the state can actually transfer Part C from one agency to another. And the governor does have to get permission from OSEP at USDOE. But the legislation that Senator Sturgeon is putting forward, along with the governor's designation, will really just help to move this along, I think, much quicker. The legislation does really provide a lot of supports that are going to be needed in order to do this efficiently and in order to do it well. So just want to really share that in addition to the legislation, the governor's office will also have to start the process of the transfer over of Part C to the Department of Education. So there are about 16 minimum requirements under Part C in order to transfer over. I'm just going to show them to you very quickly, but as I mentioned, final approval comes from USDOE. When we do start this process, we will have to reach out to OSEP to actually, one, let them know that we're starting, but also because we want to tap into their very specific TA about this. This is not an easy process, and we estimate that it will take the full 2 years. There's a lot of documentation that is required and evidence to USDOE that this is a good idea, that DOE will do it well, and that families will not have the effects of any gaps in services during the transition, but then after. On the DOE side, as I've mentioned before, we're going to have to think about regulations, existing or revising and updating existing and new ones. We're also going to have to think about our own systems and our policies and procedures that align to some of the components that we already have at DOE. We're going to have to address the OSEP findings. We're going to have to think about monitoring and data collection. And this is really kind of the big one, is our finance teams on both sides in both departments will really have to get together to think about the coordination of the funds. And also specifically so that we at DOE can understand how the funds are being used. So how much is going to actually serve kids and families, how much is being used to support staff, how much is being used on equipment and materials. So just very quickly here, these are kind of the first 5. We're going to have a definition for developmental delay. I imagine that as we go through this process, we will probably keep many of the things that are already happening, particularly as the Part C program is being slightly revised to respond to the monitoring report. So we think, there's a lot of good work there happening for sure. And I know that Cindy and other colleagues at DOE are part of those conversations. But at some point, we will have to start to dig deep into this. And one thing that we are specifically asking for, and that Senator Sturgeon has been super helpful, and Dawn has as well, is really one more employee at DOE who could actually shepherd this process through. With our current staffing pattern and the amount of folks we have, there's no way that we would be able to do this in 2 years. So as you can see, there's a lot going on here. You've got to think about your IFSPs, you got to think about your child find and referral system as well. And then most importantly for us, we also want to think about our infants and our toddlers and our homeless families out there. So keeping in mind all of those special populations. We'll have to build a public awareness program. So there is a lot of language in the law about how do you let the general public, as well as those who would access these services, know where the services are and how they can access them. So this is going to be a big part of what we have to do through this transition. We obviously will also have to do a lot of training of staff and of others who are going to be taking up this work, both within DOE, in school districts, and obviously with our childcare providers as well. And then the ongoing conversation, right? The workforce piece. So you really do have to have a staff that's adequately prepared and trained. And I think across the board, we're all thinking about this, from childcare to K-12 to higher ed, right? Just how do we bring in the people who want to do this work, but also that have the training, the competencies, and the education to do it well. And then finally, just a few more things here: timely reimbursement of funds. How do we settle disputes? So we need to have all of these pieces in place before USDOE will give permission. So there's a lot to think about. And one more slide, the State Interagency Coordinating Council, of which we have a very strong one in Delaware. At some point, I imagine that we'll have to have conversations about what does that look like? Who's on it? Do we want to rethink the members of that? So just putting that out there, because I'm sure that those conversations will all come up. And then just one more time, just really quickly, so the governor designates the lead agency. This is in the federal law. And so we'll really have to start to work with the governor's office as well as DHSS to start this process pretty soon and pretty quickly. Just a couple more things. I think I went through these pretty quickly, but anything to do with funds, we have to outline very specifically how those funds will be transferred, the amount of the funds that will be transferred, and how those funds will be used. We need to make decisions around whether we're going to bring over any equipment or other assets, any materials, any grants that have to be currently closed out, and any grants that we are going to start to have over at DOE. So it's a lot of work, but we're going to get started and we're looking forward to it, and just really appreciate both Senator Sturgeon's support and Representative Williams, and obviously Don and the whole team that's been working with us. So thank you. And I'm sorry that we went over our time.
That's all right. We axed out Mrs. Representative Williams. So you picked up a little bit of her time there. We let it run a little bit longer. Thank you very much for taking the time to present to this group, the team from DOE and those who joined to kind of educate a little bit more deeply around some of the work that we've been talking about since July with developmental screening, what it's shaping up like, boots on the ground, the future of it, what it's looking forward, and the scope of the work that's in front of us. If we could definitely get copies of this presentation, Jason, we'll put it in the minutes and link it so folks can provide any other comments to the presenters as you move forward in your work. We really appreciate the clarity that this brought to really an important piece of work that's ongoing in the state. I don't know if Secretary Bunting, if you had anything to add to this as we close up this part of the presentation. I want to cede the floor to you. Since this is now, it's looming under your house. And so we had the house analogy. You're putting the furniture in, it looks like, or painting in the line.
Some days we have overcrowded furniture. No, they did a wonderful job of outlining it. I know time is precious, and we are always willing to do what we need to do, what people trust us to do. And if more tasks or agencies or parts of agencies come over to us, we're always willing to take that on, as long as we think about space and then human resources as well.
Okay. Thank you, Secretary Bunting. Appreciate it. Okay. Thank you, ladies, for your presentation. That was very eye-opening. As a secondary person, I learned quite a bit in that abbreviated version of your presentation. So please, thank you very much. Keep up the good work. That said, I want to transition over to our second presenter, is Yvette Santiago, who is a work group member and is going to be sharing with us the elementary wellness centers, some of the research around it, and the conversation, either the state level, local level, federal level, anything to present regarding this work, because we did spend a lot of time talking about this in the fall, and we felt the need to go a little bit more in depth, and Yvette and Nemours was really gracious of bringing forward some details and information that we might not have considered, or things that can add to the conversation as we move forward. That said, Yvette, I'm just going to turn it over to you and let you run with it.
Okay, thank you, Jeff. Can you all see my screen, and can you hear me okay?
Hear you, and the screen is queuing up, I think, much like the other Yvette was. We had two Yvettes back to back. That's unbelievable.
And spelled exactly the same.
History in the making, two Yvette S's.
Yes, oh my goodness. Can't even do that. My goodness.
Boy. Okay, this screen looks a little funky on my side, but can you guys see it okay?
Yes.
Yeah, we can see
Okay,
it.
so I'm gonna go ahead and try to run through these as best as I can. Oops, sorry. So, and I thought maybe so just for a little bit of context, at Nemours, I served as the project leader when we started the Eisenberg School-Based Health Center. And so that was a partnership, certainly, with the Colonial School District and Life Health Center. And so we've learned a lot in the space of what it means to establish and what organizations such as school districts and vendors have to go through in order to actually operate an elementary school-based health center. And I'm also working with the School-Based Health Alliance. I currently serve as its vice president, and I was a member of the strategic planning state work group with public health on the next 5-year strategic plan on how we innovate school-based health centers. So, I mean, so just from the very basics, what is a school-based health center? It's essentially just a health center within a school building. And there are a lot of regulations on what that health center needs to look like. And so public health has staff that, oversee these sites. And there's a number of regulatory requirements as to what that infrastructure needs to look like. It can't just be an empty classroom with kids coming in and services being provided. Like, it really does need to have very specific parameters on space, on running water, on doors, both entry and exit, and also the ability to protect students' privacy when being seen in the health center. But all of that is done through public health, and they're the ones that actually certify a site. So if a school district or a school wanted to establish a school-based health center in their particular building, they would actually work with public health to kind of look at what their current infrastructure is, and then public health would give them all of the guidance that they would need in order for them to move forward with that plan. School-based health centers are typically staffed by clinicians. Most of the time it's nurse practitioners or physician assistants, but school-based health centers must have a medical director, MD degree, to oversee the work that's happening in a school-based health center. We also have counselors or behavioral health specialists that are able to work with the students to address emotional and behavioral health issues that students may come in to be seen for. And certainly you have your medical assistants that help to manage the medical records, as well as general activities related to biometrics, blood pressure, weight, those kinds of things. School-based health centers provide an array of physical and emotional health services. Historically, when school-based health centers first started in the state of Delaware back in the 80s, it was really to address teen pregnancy. And so the intent was to provide a lot of education and support around young teenage girls that were pregnant. So Delaware is the only state that has established school-based health centers where need is not the primary focus. All other states across the country base school-based health, set up school-based health centers based on the needs of the population. It's usually low income, minority, and high disparate communities or schools that are serving that particular community. So Delaware is an outlier in that, but we are turning the tide on that in the work that Representative Williams has been leading legislatively. One of the positives for school-based health centers, it helps to connect students to a medical home. Medical home is essentially that core group of providers that are able to support kids for their physical and emotional and behavioral health needs. And a lot of times kids come to school, they haven't seen a primary care doctor in quite some time, or don't even have one on record. And so if a parent authorizes for their child to be seen in a school-based health center, that is one of the things that can be accomplished through that center, is connecting kids back to a primary care physician that potentially is close to their home. So we know that there are a ton of benefits to school-based health centers. Kids spend the majority of their day in school, and so why not make sure that they have everything that they need while they're there? I mean, we know, and at least working, in a school district for many years, we know that schools are tapped with so many things on top of just having to educate students, right? No matter what it is, we know, I have my Department of Ed colleagues and Secretary Bunning on. Anytime there's something that needs to happen with kids, the first thing they do is, well, let's do it through the schools. Well, let's reach out to the superintendents, or let's reach out to the principals. And we know there's a valid reason for that. And it is because schools have the have a captive audience, and that is kids. And for the most part, their ability to reach out to families, to the parents of the kids. And so, school-based health centers have numerous benefits, and, increasing school attendance, we know, is one of those benefits. We know that if kids are healthy and come to school healthy, that they're going to be able to learn at the rate that they're developmentally able to learn. We know that kids that if they come to school and they're not feeling well, if they're able to get referred for the appropriate services at the time that they need those services, I think that's even more important, to make sure that kids are getting the necessary services they need when they actually need them, and help to mitigate any future health issues by delaying the onset of treatment. We know that school-based health centers help to provide wraparound services for at-risk students, and to make those connections not only within the school, but also outside of the school. Another benefit of school-based health centers is it really helps to provide those healthy school practices through health education. They focus on healthy eating, active living, substance abuse prevention, ways to stay healthy, both emotionally and physically. And so those are all things that enable, kids to have those benefits of a school-based health center. School-based health centers also help to provide those, as I mentioned, build those local partnerships to support those expanded health services. So if they cannot provide the services within their site, they reach out to those other local providers that perhaps could help to address some of those issues that may be impacting the students. Another benefit is that if kids are getting the necessary treatment when they need it, they don't go to the emergency room as much. And that has long-term impacts across the entire state. One major area that we know is a benefit is that it improves child health outcomes when they're getting the necessary treatment. And it also improves their access to healthcare services. We know that there are major gaps and disparities in our kids of color and low income, and school-based health centers can help mitigate those and help to decrease the health disparities that we currently see. So as far as school attendance goes, we know that under the school National School-Based Health Alliance, like chronic absenteeism is defined as missing more than 10% of school a year. And when kids are chronically absent, none of this is new to us. We know there's lower academic performance, graduation rates are much lower. There's a higher risk for kids to be involved in alcohol and substance abuse, and there's a higher propensity for involvement with violence and gangs and other less healthy behaviors. And so we also know that students living in poverty are most likely to experience chronic absenteeism, as well as chronic illnesses such as asthma and other respiratory disorders or conditions. We also know that students who report being bullied are more likely to be chronically absent from school. A lot of this data is really not new to any of us. Many of the top health-related causes resulting from kids missing school are asthma, mental health disorders, and dental emergencies. We know that childhood trauma is a huge thing. And school-based health centers help to connect kids to services that help to support not only their health, but also their safety and welfare. And we also work with families to help bring in those necessary services. It's important to recognize that trauma is defined very differently across individuals, across groups, across families. What I may consider to be a traumatic experience may be very different than what someone else considers a traumatic experience to be. But we know that all of these things impact the emotional well-being of students, and because it impacts their emotional well-being, it does have a trickle effect into their physical health. And so making sure that we provide the necessary supports as early as possible for those intervention services to support emotional and behavioral health and be in trauma informed and trauma responsive is key to making sure kids are getting the type of care that they need. So we know that when kids are seen through school-based health centers and through their primary care doctors, we know that healthcare access increases. We know that if they're likely to go to a health center at a school, a lot of times they will follow up with their primary care doctor, or maybe even their dentist, or maybe a social worker or therapist outside of school. We also know that there's a likelihood then to receive their annual checkups, including going to the dentist. And as I mentioned before, it decreases hospitalizations as well as going to the emergency room. You know, when kids are seen in the emergency room for non-emergent, or sometimes families use the emergency room as their primary care doctor. And we know that that's extremely costly. And the intent is to keep kids going to the doctor as regular, as they possibly can, doing their regular visits and not using the emergency room, because those costs are extremely high. And so our goal is to always make sure that kids are connected to a primary care doc. We know that when kids are healthy, their academic performance is much better. We know that when kids are getting the necessary care that they need, it positively impacts attendance, it improves graduation rates, and it reduces disciplinary problems. I know that at Eisenberg, we had extremely compelling positive data on improved attendance and decreased incidence of behavior. Dr. Menzer is the superintendent there, and he knows all of the positive strides that have occurred as a result of the school-based health center there. States that have school-based health centers that serve Medicaid providers have higher student achievement results. And also at Eisenberg, there is data to show that there was significant gains in academic achievement as a result of the work that was happening at that particular school. And I will say that even though they had a school-based health center, they also had a number of other services supporting students. And so when we're talking about those wraparound services, not just a one and done, it's not one bullet that, helps to solve all these. It is a system that is put together and it's connected, and the communication is intact and happens throughout the entire school day for that particular child. And that's what enables the success to happen, because you can have wraparound services, and when people aren't speaking to each other or connecting on a particular student, guess what? Things are going to continue to fall through the cracks. States that oversee health education and health services have higher test scores and lower dropout rates. Impact on healthcare costs. I talked a little bit about how extremely expensive it is for kids to go to the emergency room as opposed to being seen either at their school-based health center or in the emergency department. School-based immunization initiatives prevent disease and can also save money overall to not only our society, but our local community. According to National School-Based Health Alliance, now not all school-based health centers deliver the same types of services. Some are very common and others are outliers depending on the needs of the student population in that particular school. But for the first three, primary care, mental health, and other supportive services are pretty much a staple in school-based health centers. And then there are others, as I mentioned, depending on the needs of the student population, offer additional services such as comprehensive health assessment, treatment of acute illnesses. They're able to provide prescriptions, asthma treatment, and screening for vision, hearing, and scoliosis. Primary prevention services include immunizations, pregnancy testing, substance abuse testing, violence prevention, dropout prevention, oral health education, and dental screenings. I know in Delaware, in the regulations, it states the number of things that have to be provided within a school-based center in order for it to be categorized as such. Also, the school hours determine when that school-based health center can stay open. So it's very loosely defined, because many schools are open from like 7 in the morning to 9 o'clock at night because of the number of extended school day activities that are occurring. So essentially that school-based health center could stay open during those hours and offer after school hours for service. And there are some in the state that currently do that. This is just a visual on the framework that is used by the School-Based Health Alliance. And really the framework is really a depiction to show that when school-based health centers provide all of these things, the health education, and it's done in a way that provides positive patient satisfaction, and there's increased use for additional recommended services, such as following up with their doctor, increased access to other services, and receiving earlier diagnoses, that once all of these things occur, that these are all of the outcomes and impacts as a result of that intervention. And at the end, really, this focus is to get to health equity. As I mentioned earlier, with the exception of Delaware, across the country, all school-based health centers are based on need, and that is typically focused on low income, disparate communities, people of color. And so that this framework enables that work towards health equity. We know, I mentioned a little bit about this short while ago around the cost-effective investments. We know that this data here is specific to Dallas, Texas. School-based health centers found that medical services help to decrease absences by 50%. Also, students who receive mental health services had an 85% decline in school discipline referrals. In Delaware, we do see data that is very consistent with this. It is school-based health centers attract harder to reach populations such as minorities and males, and they do a better job of getting them the necessary services such as mental health care and high-risk behavior screens. 2 studies found that adolescents were 10 to 21 times more likely to come to a school-based health center for mental health services than the community health center network, or HMO. And that makes a whole lot of sense, because kids are definitely going to go seek care in a very comfortable and known setting versus going somewhere where perhaps maybe they've never been or don't feel as comfortable. And we know that schools are able to offer that level of comfort to our students. And because it is a known entity, they're more likely to go there and get the necessary services. More additional data around cost-effective investments. This one is specific to an elementary school-based health center in Montefiore Medical Center that's out in New York. Was a reduction in hospitalization and an increase in school attendance among inner city school children for asthma. They had decreases in hospitalization rates of 75 to 85% and improvements in the use of their peak flow meters and inhalers. Mathematica Policy Research conducted a national multi-site study and found a significant increase in healthcare access by students who use school-based health centers. 71% of the students reported that they had visited a healthcare center in the past year, compared to 59% of students who did not have access to a school-based health center. So the data is extremely compelling. And this is not new to any of us. I mean, I think that is one of the reasons why right now, there are a number of school districts across the state trying to establish school-based health centers in their elementary schools now. We know that kids that are not healthy impacts their educational progress. And it's because when you're not well, just like we are as adults, you're just not there. You're just not performing and functioning at the level that you would if you were healthy. You're not as motivated to learn when you're not feeling well. You're not open to those new ideas and creative learning strategies when you're just not healthy. We know that school-based health center help to address disparities and reduce that when it is done in a coordinated approach. School-based health centers help on the state and local level as it relates to advocating for policy changes necessary to implement to implement them. We are doing this now in the state of Delaware. As I mentioned, that over the last year, the state has convened a stakeholder work group to update the strategic plan, as well as discuss a lot of the finance and sustainability strategies that are necessary to sustain school-based health centers year in and year out. Many of you are probably aware of House Bill 129, which is sponsored by Representative Kim Williams, and that is the piece of legislation to establish at least 2 school-based wellness centers in high needs elementary schools, with the quote unquote of high needs being a lot of the language that dominates that legislation. Again, as I mentioned, when school-based health centers were established for high schools here in Delaware, the intent was to address the teen pregnancy rate at that time. So we did not establish school-based health centers based on need. We established it based on the teen pregnancy rate. And so right now, the state strategic plan, I believe in the next several weeks, but there were a couple of town halls that were held by public health a few weeks ago to show the strategic plan and all of the recommendations related to school-based health centers. And so the next that we're finalizing those recommendations and making a couple of tweaks and edits based on feedback and input. And then I believe it's going to move on to its final state. A lot of funding is necessary for elementary school-based health centers. If there are, a lot of people say, well, at trying to establish 2 elementary school-based health centers a year is going to take us forever in Delaware to get to it. There are some school districts that if they have the financial resources and the current infrastructure in place, they can do it. They could just simply work with public health and say, you know what, I want to start something here, and how do I go about doing that? And I can work with a local healthcare vendor to provide services within my building. And be outside of that high needs elementary school that would get the state funding. But it is not sustainable for healthcare providers, because right now there are many of the healthcare providers, if not all, operate in the red. School-based health centers, are not a money-making business. Many times they serve kids and they're not getting reimbursed for the services that they do provide. The other pieces for services related to sexual and reproductive health and mental health, many times they do not bill the insurance because it impacts and it compromises the confidentiality. And so we all know that if we're seen at the doctor's, we get an explanation of benefits mailed home that details, all of the things that occurred at that visit. And so in the spirit of maintaining HIPAA and not violating confidentiality, the explanation of benefits are not sent home because no bill is ever submitted for reimbursement. And so as a result, the healthcare providers have to eat those costs. So there's a lot of work that we're doing at the state level to address the financing and sustainability of that. I mentioned House Bill 129 and
Yvette, there is a question in the chat. I want to.
Yep. So I'm ready for questions.
Ray brought it up about reporting requirement. Have the reporting requirements for school personnel to apply for Medicaid reimbursement for services been streamlined? I know that's been Ray popped that in there. Is that something that's on this group's radar with respect to the work in the strategic plan?
Can you repeat the question again? I only caught part of it.
It's have the reporting requirements for school personnel to apply for Medicaid reimbursement for services been streamlined? I don't know. I know there was some talk about this. Maybe you can provide some context.
Yeah, so it has not been streamlined as of yet. Right now, we are working with the state to address a lot of the reporting requirements. There are a number of different codes that go into that. There are some services that we don't even have codes for. So we're, through the state level strategic plan, we're trying to address that in our work groups that are going to help us get towards implementation. So It is an issue. We're continuing to make progress on that, but we still have a little bit of ways to go on that.
Thanks. I didn't see any other questions that came up. I did see a question about telemedicine. Do you want to talk real briefly about what the pandemic has done to that body of work for school-based wellness centers, maybe, and then we can kind of wrap up the presentation.
Absolutely. So yeah, so telehealth is offered in school-based health centers. Hold on, let me get this. My screen's like jumping around right now. Okay. So telehealth can be offered at school-based health centers, and actually that was one of the silver linings with COVID, was that we were able to use the technology for kids to be able to be seen. There is technology that has to be embedded into the infrastructure of that school-based health center in order for that to take place. So there's certain iPads and certain technology that are needed in order for that to happen. One of the things that we established at Eisenberg was this hub and spoke model, which essentially the hub of the school-based health center was at Eisenberg, and some of the other elementary schools that were within close proximity of Eisenberg were like the spokes to that hub at Eisenberg. And the telehealth model can be used for that. You can use it between hubs and spokes of a particular school-based health center, or you can use it between the actual primary care provider and the school-based health center. So telemedicine, it's interesting because it was used, but not as much. And then with COVID, that is one of the areas that significantly grew as a result of the pandemic. But that certainly is an opportunity, and we established a business plan for how that could happen, and reimbursements actually do happen through Medicaid. Based off of the site where the originating service is being provided.
Great, thanks, Yvette. Okay, thank you, Yvette, for the presentation. I know that in your work group in our larger body, this is what you guys lived and breathed and talked about, but when you share it more with some of the groups who were doing other work in other spaces, I think it's helpful to give context to the scope of work that goes on in the school-based wellness centers and the complexity of it, much like we just saw in the previous presentation from Dawn and the DOE crew about developmental screening in Part C. So I think it was very helpful to share with the larger body work group the kinds of things that go on in the wellness centers, and also what are the challenges, and those challenges being pretty significant in terms of the fiscal costs and the operation of it, but the benefits that you provided and showed, I think definitely make the case that it's an investment that needs to be strongly considered and is getting the attention that it needs. So thank you very much.
And families are also getting the benefit because they're able to, be able to be connected outside of the school setting. So that family care that's necessary for things to be successful is also happening. Great. Or potential to happen if it's not.
Thanks, Yvette. We appreciate it. At this point, I'm going to, before we lose the quorum, I would like to, if I know we received the minutes from our last meeting, I believe it was in March. If Jason, if you could just put them up on the screen or put them on the chat. We do need to get a motion to approve the minutes. Anybody who is still with us, there they go into the Google. Roger. Roger moved.
This is I second.
All right, there's a second. Signified by our silence as a vote. All those in favor, silent. Those opposed, please speak now and oppose with a nay vote. Great, thank you. Wanted to get that in before we lost. We were at a pretty high up there, and then we were getting closer. So I wanted to make sure we got it while we still had 10. Thanks, Jason, for keeping us on point with that. That said, before we get to public comment, I think, these presentations that will go a little bit more in depth around some of the nooks and crannies of what our recommendations were, I think are very helpful. Encourage the work group members, if you have any other thoughts around topics for our June meeting, we definitely will have Representative Williams on the agenda. We'll try to coordinate a little bit better with the schedule so that possibly she's not pulled away for something in June. I highly doubt that, but we might be able to find an afternoon where we can get her for a few minutes. But so we would definitely be looking for presentations in the future for our next meeting. So board members of the group, shoot Ray or I or Jason an email with any thoughts, and then we'll connect and kind of develop a path forward. Before we get to public comment and people might jump off, I think we have greatness in our presence. I think it's important that we acknowledge Dr. Evelyn Edney, who was named Delaware Principal of the Year by NASS. So Dr. Edney, do you have a few words for us? Take a bow, maybe. Come on.
Thank you so much. That's very sweet. I appreciate it. I appreciate everybody who's sent me a message or a text or something on social media. I'm feeling the love from Delaware, so I really appreciate it. Thanks.
That's really awesome, and it's really special, Evelyn. I mean, I'm excited for you. That's a huge victory for you as a professional, but for the state of Delaware and all the work that goes on here. So congratulations, enjoy it, relish the moment, and go get them. Let's get national now, right? You're in the next round, right?
Oh, you're killing me. I don't know. They're still looking through all the applications, but I will try to represent us well.
You're in the mix. That's what counts.
Right. Thanks.
So, all right. I just wanted to get that in there before we get to public comment. Jason, did we get any questions from the comments from the public?
I did not see any public comments or questions in the chat, but if you want to give folks a minute or two to chime in, I'm all for it.
Now would be the time. Seeing none, do I hear a motion to adjourn?
Before we do that, I don't know if Matt has any updates or any any information.
Matt did come in.
I will. I literally see the word adjourn in front of my eyes, so I'll be very. The Joint Finance Committee is going to be starting its markup in a couple weeks, and it looks like we are doing. It's all a lot of tea leaf reading right now, but we seem to be making pretty good progress in terms of getting their attention about the recommendations that we sent. And Senator Lockman sent around to other Joint Finance Committee members a request that they basically sign on to the Reading Consortium's budget recommendations. She just sent that around late last week, and she's already gotten a number of responses from her fellow committee members saying that they were, joining in the request. So again, nothing's until it's on paper, nothing's official, but it looks like it's making good progress.
Thanks, Matt.
Right. Thank you, Matt. I also would like to invite you all to Monday, May 24th, 7 p.m. That's the next edition of the Wilmington Center for Education Equity's monthly Monday series. Dr. Malik Muhammad will be our featured speaker. He will be talking about restorative practices. Very interesting. Wow. And he's joined by colonial teacher, mindfulness, Kyrie. What's his last name, Jay?
Kyrie Bay.
Mm-hmm. Kyrie Bay. I believe he was also received an honor last year, and Quetta Jones from the Red Clay School District. So that's 7 p.m. May 24th. I'll send Jason a social media post and ask him to circulate it.
That's shaping up to be quite an impressive. That'll be a great presentation. They all are dynamite presenters, so that's going to be a good one. Thanks, Ray, for the plug.
Mm-hmm.
All right.
So
is there anything else, Ray?
Nope.
Roger, come on, let's go. are you gonna motion to adjourn or what?
Motion.
Yay, get a second.
Second, this is Tamara.
All right, all thumbs up. Good to see you all. Take care.
All right. Take care. Thanks, everybody.
Thank you. Thank you very much.
Yep.
Bye.